We could begin this film with the following words: people, events, happenings, everything the absence of which does not allow to imagine and understand. It doesn't really seem to be a long time ago, but 50 years have already passed. In 1961, the medical faculty of People's Friendship University started its history. At that time, most of its departments and lecture rooms were situated at the first medical institute named after Sеченова. The resettlement to the new educational building took place some years later. There were 7 groups in the first intake of students, and there were 15 people in each of them. Foreign students from 35 countries of the world were in the majority. There were 1 or 2 Soviet students in each group. 5 years later, these students became the first graduates of the medical faculty. Among them, there was Doctor of Medical Science, Professor, the head of the course History of Medicine, Сорокина Татьяна Сергеевна.
Мне кажется, что самое главное, что было в те годы, это желание студентов учиться. В моей группе было 5 студентов из Нигерии.
I think that the most important feature of the time was students' desire to study. There were 5 students from Nigeria in my group. Each of them got only excellent marks for all 6 years, and they got diplomas with honors. It was their intention to study, their appreciation to the country which was educating them, the desire to participate in all events, the desire to spend a lot of time in clinic. They went to clinic in the evening and worked all night there, and then they came to classes at 9 o'clock next morning.
И там они просто ночевали, а потом утром приходили на занятия в 9 часов утра.
In the first graduates of doctors, there was also Tatiana Sorokina's study partner, Dmitry Petrovich Bilibin. His curriculum vitae resembles an encyclopedia entitled From A to Z. In 1973, Dmitry Petrovich Bilibin was the dean of the medical faculty, and from 1998 to 2005, he was at first an acting rector and then the rector of People's Friendship University of Russia. Serious responsibility of working with foreign students fell on us, because we had to help and explain to them a lot. We had to gather, to organize something. There was plenty of work to do. It is that time when amateur art activities began to develop. It is that time when Club of the Funny and Inventive and also Students' Scientific Society appeared at our university. We had very much work to do, and what was particularly important, we had to study very well. Soviet students could not permit themselves to have worse results in their studies than young people from Africa, Asia and Latin America. At least we had to study with no satisfactory marks. That is for sure. One could be seriously responsible even for a satisfactory mark. Over its history, the medical faculty was governed by 8 deans. Each of them made a major contribution to the development and prosperity of the faculty. Since 1983 until now, the medical faculty has been governed by Doctor of Medical Science, Professor Frolov Viktor Alexeyevich, who has also been the chairman of the Council of Deans, leading medical faculties of the state Russian universities since 1999. This decision was taken by the Ministry of Public Health and the Ministry of Education 12 years ago.
Медицинский факультет в своей деятельности подчинен одной задаче – подготовке высококвалифицированных врачей.
Like the other faculties of People's Friendship University of Russia, the medical faculty is committed to one particular purpose – preparation of highly skilled doctors. So the activity of our faculty consists of 3 parts: educational work, which is combined with teaching work at clinical departments, research work, and extracurricular activity. These are 3 pillars which the faculty must lean on. There must be a principle of which justice. I have received evidence for this time. There are no spiritually deprived young people, but there can be spiritually deprived teachers. I suggest that one of the most important purposes in the dean's activity is to keep young people from such teachers. Young people must be in the priority. I always try to support, to promote and to help them. I hope I manage this job well. This is one of the lecture halls in the medical faculty. Studies are running according to the classical scheme, a lecturer and students. But in this common tandem, we can see an extraordinary person. This is Professor, Academician of the Russian Academy of Medical Sciences, Berezov Timirbalat Timbalatovich. In 1962, the Department of Biochemistry was founded at the faculty, and until 1996, it was headed by Professor Berezov. The Department of Biochemistry is the professor's brainchild and pride. Professor Berezov was the first at People's Friendship University to become an academician of the Russian Academy of Medical Sciences. Professor Berezov was in charge of establishment of a biochemical scientific school corresponding all the contemporary requirements of scientific and educational personnel training. For many times, Professor Berezov presented the achievements of Russian biochemistry in foreign countries. He is the author of 10 textbooks, including the base course on biochemistry, recommended for medical institutes and universities by the Soviet Ministry of Higher Education and the Russian Ministry of Education. We organized quite a good biochemical laboratory for students. We also organized practice. We prepared a program for this practice in cooperation with students. I invited very good young people from the First Medical Institute and from Moscow State University to work as lecturers and associate professors, and so we organized a very good department at that time. Among the prominent figures of the medical faculty, there is also Professor, Academician of the Russian Academy of Medical Sciences, Agadjanyan Nikolai Alexandrovich. From 1981 to 1998, he was the head of the Department of Human Physiology. His works and recommendations were successfully used at cosmonauts training. Professor Agadjanyan took direct part in the preparation and medical provision of the first cosmic flights of the man. Yuri Gagarin and the whole crew of the future cosmonauts underwent this preparation. I conducted pioneer research in cosmic medicine. I took part in cosmonaut selection and preparation. According to Pavlov's words, science demands strong effort and great passion from the man. This is the passion which I had, particularly when I was young. There is another outstanding person in the history of the medical faculty. It is Professor Kirpatovsky Igor Dmitrievich, who is famous both in Russia and abroad for his works in the field of clinical and experimental transplantology, andrology and experimental surgery. He was the first to set a new subject, clinical andrology, in the educational program at medical institutes. Under his direction, the Department of Topographic Anatomy and Operative Surgery was organized at the medical faculty. From 1963 to 1997, Professor Kirpatovsky was the head of this department. In 1970, the department opened its hospital base, where classes for students were held. Since 1997, the department has been headed by Professor Smirnova Eleonora Dmitrievna, who is Professor Kirpatovsky's scientific follower. For 50 years, a great deal has been done, but there is much yet to do in order to maintain the reputation of one of the best medical faculties, which is widely known both in Russia and in the world. Today, there are 4 specialties at the medical faculty: general medicine, dentistry, pharmacy, and nurse business. The specialty pharmacy appeared in 1994. It so happened historically that Moscow Medical Academy, named after Sечenova, became the first house for teaching. This history repeated this time again. But 4 years later, all classes with all the courses of this specialty and with its staff began in the lecture rooms of the medical faculty. Nowadays, this specialty is taught both as a full-time and a correspondence course.
На заочное обучение по специальности фармация принимают людей только со средним фармацевтическим образованием. Это фармацевты. Или могут быть еще медицинские сестры.
People who already have a secondary pharmaceutical education are admitted to the correspondence course of the specialty pharmacy. So 95% of students have some idea about graduating disciplines. Most of them work at pharmacists. The diploma of a pharmacist gives lots of opportunities of working at a distributor companies and pharmaceutical enterprises. And it's not so important whether it was a full-time or a correspondence course of education. Our graduates also work at the Ministry of Public Health and Social Development. There are good books there.
Наши выпускники работают в Министерстве здравоохранения и социального развития, мы там очень довольны.
The specialty dentistry started its way at the faculty in 1998. Before that, there was only one stomatological department where students studying general medicine were taught. The curriculum provided very few hours for this subject, and then the department organized several special courses, which were afterwards transformed into independent new departments.
Сегодня мы располагаем клиническими базами. Так, в частности, у нас в качестве клинических баз
Today, we dispose of some hospital bases. In particular, some network dental clinics are represented as clinical bases. There are 15 network clinics where students work in the same conditions, use the same material and technical basis, and cooperate with highly skilled personnel. Opening of the dental center at the faculty will extend these facilities a lot. It will open up opportunities for fruitful work, not only for students, but also for lecturers, associate professors, the heads of the departments who must teach their students how to work by that personal example. In 2004, 3 main specialties were joined by the 4th one, nurse business, which is taught as a correspondence course. It can be said with no exaggeration that the medical faculty is the second house for its students and teaching staff. That is why the atmosphere is so trust here. They are proud of it at the faculty. This maintains the foundation of wisdom, kindness, unlimited talent, which were put into the basis of the medical faculty half a century ago.
Конечно, 50-летие – это очень важный рубеж.
Certainly, 50th anniversary is a very important term, and it's very nice that the medical faculty is meeting it in the prime of its life, when there is potential, when we have established the medical center, when the professors' abilities are realized in particular in tens of departments at the faculty of refresher training for healthcare professionals. And if this faculty is in demand, it means that there is a need in the knowledge and the skills which are possessed by the lecturers of People's Friendship University of Russia. Out of 10 faculties of People's Friendship University of Russia, the medical faculty is the biggest one. There are 43 departments and 2 independent courses in it. More than 2,300 students are taught by 420 lecturers, including academicians, correspondent members of the Russian Academy of Medical Sciences and various public academies, honored science workers of the Russian Federation, laureates of state prizes, doctors and candidates of science. The Department of General Pharmaceutical and Biomedical Technology is guided by one of academicians of the Russian Academy of Medical Sciences. Professor Bykov Valery Alexeyevich is the head of one of the young departments at the medical faculty. Its history started in 1994. In educational process, pharmaceutical technology is a special course summarizing the knowledge obtained by students in the field of fundamental natural sciences.
Меня пригласили организовать эту кафедру.
I was invited to organize this department, and I did it. At that time, it was named the Department of Biotechnology. At that time, some terms like biotechnology, genomics, proteomics began to be widely introduced into educational system. These ones and some other scientific directions had to be familiar both to doctors and to pharmaceutists. The 21st century is a century of scientific life, and strictly speaking, the discipline that we are dealing with will develop crescendo, and this is what we already see today. Pharmaceutical technology is a chief subject for a specialist with a higher education, pharmaceutist. Professor Bykov is a founder of this discipline at the medical faculty. Students study pharmaceutical technology in their 3rd, 4th and 5th years of education. During this period, they undergo their practical training. This is an essential step of professional education for a medical student. For students who study general medicine, the teachers of this department arrange a practical course on biological technology. It familiarizes future doctors with the achievements in this field and covers the state as well as lines of development of medication biotechnology, both traditional and innovative ones. And now the Department of Faculty Therapy, which on the contrary has been working since the establishment of the medical faculty. From 1983, it has been led by academician of the Russian Academy of Medical Sciences, Professor Moiseev Valentin Sergeyevich. The Department of Faculty Therapy is situated at 64 Clinical Hospital of Moscow. Practical classes envisage some days of students' independent work at patients' beds. After an examination of patients, medical students present their written works containing a diagnosis, its explanation and a plan of treatment. This close cooperation between the two teams of the hospital and the department gave a positive effect. Hospital doctors began teaching at the Department of Faculty Therapy, and some lecturers of the department also became the heads of hospital units.
Очень важным является взаимодействие больницы и кафедры, клиник, в которых они находятся.
Cooperation between the department and the hospital in which it is based is of great importance. In the recent years, we've been setting such a contact with the hospital management and with its medical staff. All the chiefs of hospital units work at the university departments as well.
This
is another department of the medical faculty, the Department of Propedeutics of Internal Diseases, which is inseparably linked with the Department of Faculty Therapy. Its independent life started in 2002, when the Department of Faculty Therapy divided into two parts. The Department of Propedeutics of Internal Diseases is headed by a graduate of People's Friendship University, Professor Kabalava Zhana Davidovna. The professor makes a major contribution to the development of new methods of diagnostics and treatment of cardiovascular diseases. For example, ultrasonic diagnostics of ischemic heart disease is actively used in educational process. This method is particularly important for patients in the cardio-reanimation unit and in the cardiological unit because it allows to diagnose acute myocardial infarction rapidly.
То, чем мы занимаемся, изучением упругоэластических свойств магистральных сосудов. Это направление очень важное.
We're dealing with the research of plastic elastic characteristics of central blood vessels. This direction is very important. It defines facilities of prophylactic cardiology. Medicine of the future is preventive medicine. Methods allowing to diagnose early stages of different diseases, particularly cardiovascular ones, play an important role in our work. We also try very hard to develop pulmonology as well as an early detection of chronic obstructive heart disease. We deal with gastroenterology, which disposes of very many innovative methods.
The Department of Propedeutics of Internal Diseases is situated at 64 City Hospital of Moscow. Students have got an excellent possibility to put their theoretic knowledge into practice, to study some diseases in details, and to develop their practical skills of patient examination. By tradition, The staff of this department is included in various organizing and scientific committees of Russian national forums and takes active part in Russian and international scientific congresses. There is another department which came to life not so long time ago, in 2001. It is the Department of Therapeutic Dentistry. It is headed by Daurova Fatima Yurievna. The priority scientific direction of this department is research work on diagnostics, prophylaxis and treatment of periodontal diseases. In their clinical practice, the workers of this department try to use new developments which are actively applied to the teaching activities.
По приказу ректора нашего университета открываем лечебный, диагностический, научно-образовательный стоматологический центр, который еще больше расширит горизонты для ведения не только учебной, но и
According to the rector's order, we are opening a dental scientific educational center, which will expand boundaries of both studying and healing work. Since 2004, our students who study dentistry at medical faculty go abroad for one-week training courses. In particular, they studied at the training center Ivoklar Vivadent in Germany and Switzerland. 6 senior students also went to Würzburg University for a 2-month study course.
6 студентов нашего 5-го курса на 2-месячную стажировку в Вюрцбургский университет.
The resource base of the department is equipped with modern devices, allowing students to have better visual studying at their practical classes. Since the date of its foundation, the Student Scientific Circle has been running at this department. Authors of the best works produced by future dentists participate in scientific conferences. And conferences of a very high level are arranged by another division of the medical faculty called Network of Young Doctors and Health Administrators, named SOMVOZ. SOMVOZ was created in 1999. Nowadays, this community unites representatives of Russian and foreign medical schools. SOMVOZ is headed by a graduate of the medical faculty, Agarwal Rajesh Kumar. For these years, SOMVOZ has held a lot of events which have become important for the scientific life of many countries. These young people have yet to take part in conferences, to undergo practice and to have a very busy studying schedule. They are just comprehending elementaries of medicine. Their lessons are held at the Medico-Biological Preparatory School called MEDIC. It was founded in 1992 due to one of its teachers, Shimkevich Tatiana Lvovna. The Director General of School MEDIC is Doctor of Medical Science, Professor Dimurov Evgeny Arkadyevich. All the pupils who enter the medical faculty are our best students. Many of them study very well and graduate with honor. Many of them are now lecturers, doctors and candidates of science. Their example is followed by other students, and we hold them as an example. So such distinguished school leavers we do have. Pre-university preparation of entrance involves biology, chemistry, physics, Russian and literature. The teachers of the school MEDIC are professors and associate professors of the medical faculty of People's Friendship University of Russia. Most of today's students, postgraduates and clinical residents are former pupils of the school MEDIC. The listener of the first intake of the Medico-Biological School, Blagonravov Mikhail, has already defended his doctoral dissertation. MEDIC gave me everything. It gave me a start in life. Thanks to the Medico-Biological School, I entered People's Friendship University of Russia on the first try. All the capacities of successful entering the university were given to me by the Medico-Biological School. Moreover, I should say that when I came to People's Friendship University for the first time in 1992, I liked it so much here that I decided to stay. After a month of studying at MEDIC, I realized that I would not try to enter to any other institute except People's Friendship University. Apart from the title the biggest faculty of People's Friendship University of Russia, it is one of the most equipped faculties. The resource base of the faculty involves modern facility corresponding the latest trends in the field of medicine. So future medics know firsthand about new technologies and methods since their student days. In the frame of the innovative educational program of People's Friendship University of Russia, 14 laboratories were founded and modernized at the medical faculty. The total sum of the instrument base exceeds $4 million. In the frame of the national project Education, in which our university was the winner among the higher education institutions of the Russian Federation, People's Friendship University, and in particular the medical faculty, had the opportunity to upgrade the departments and laboratories with the newest equipment that will allow to perform contemporary investigations, to apply to the practice, including training of specialists. Very many innovative technologies are being realized at the faculty, and perhaps it's no coincidence that graduates of the faculty are in great demand, both in science and in practice. The newest equipment purchased in the frame of the innovative educational program is actively used at classes at the Department of Anesthesiology and Reanimation. The mannequin imitating a patient named SimMan allows to examine students' skills to take decisions in various clinical situations. An absolutely realistic portable simulator was specially developed for difficult cases of restoration of airways patency, including such complications as trismus, edema of the tongue, edema of the gullet, and laryngospasm. We have got two operating rooms, a small one and a large one. In the large operating room, laparoscopic operations are performed. Some devices, including primers and a narcosis respiratory apparatus named Infinity Monitoring, have been purchased. This device is of great importance during an operation. It controls essential functions of the organism. An apparatus for artificial respiration and an apparatus detecting acid-base balance have also been bought. There is also a mini-express laboratory for anesthesia and post-operative care. The Department of Faculty Surgery takes part in the innovative educational program too. In the frame of the project, some modern equipment has been bought. Minimally invasive surgical treatment and diagnostics training is held under ultrasonic control. There is another important direction in the educational process. It is endoscopic diagnostics. Modern endoscopy plays a particular role in diagnostics of different diseases, especially cancer, at an early stage. New equipment allowed to give classes on laparoscopic operations with the use of mechanical and virtual simulators.
Виртуальный тренажер, на котором отрабатываются эндоскопические операции и технические действия при выполнении.
This is a virtual simulator, which is used to practice endoscopic operations and some technical methods of different surgical operations. There are models of several operations, appendectomy or cystectomy. The technique of these operations can be practiced on this simulator at classes of the Students' Circle at the Department of Operative Surgery. Students who are in their 4th year and who have already studied some parts of surgery use this apparatus actively. At the Department of Ophthalmology, the laboratory named Innovative Methods of Treatment of Ocular Pathology was founded in the frame of the Priority National Project Education. It is equipped with the newest ophthalmologic operative stereo microscope. It is intended for operations on the eyeball. A digital fundus camera, which was purchased by the project, enables to examine and to photograph central and peripheral portions of the retina. An ophthalmologic retina tomograph makes three-dimensional images of the form of optic nerve disc and its automatic analysis for the further diagnostics of glaucoma.
Приобретенное оборудование позволяет кафедре решать вопросы учебной подготовки студентов, ординаторов и аспирантов.
The purchased equipment allows the department to prepare students, clinical residents and postgraduates. It also helps to train doctor postgraduates and the faculty of refresher training for healthcare professionals to develop the scientific direction of the department and realize diagnostic and treatment work at a very high level. Having gained these modern methods, our graduates become highly skilled specialists. Nowadays, great attention in the whole world is being paid to women's health and women's reproductive system. This direction is of high priority in modern public health service. This important problem is being solved jointly with practical health service and the research facilities of higher education institutions. The example of such effective cooperation is the Department of Obstetrics and Gynecology with the course of perinatology. The innovative educational program allowed to provide the department with modern equipment. An ultrasonic training USB system allows to get images of internal organs in a real-time mode or images on the screen in a two-dimensional mode. And a system of diagnostic ultrasonic EPLEO provides high-quality ultrasonic images for all types of 2D, 3D and 4D modes. The equipment allows to give classes on ultrasonic diagnostics and to detect various obstetric gynecologic states at a totally new level.
Наша кафедра, войдя в инновационную образовательную программу, получила оборудование для создания...
On joining the innovative educational program, our department got some new equipment for the laboratory named early stages of pregnancy, and our ultrasonic apparatus and some other devices for instrumental observation and evaluation of a pregnant woman's state allowed us to come before this Congress with some very impressive results. There is another department at the medical faculty, the Department of Traumatology and Orthopedics. Since 1992, it has been headed by a graduate of the medical faculty, Professor Zagorodny Nikolai Vasilievich. The department is conducting a revolution in the field of replacement arthroplasty. Professor Zagorodny is a real doctor. His scientific discoveries are well known all over the world. Professor Zagorodny was generally recognized by becoming the best doctor of 2010. In the frame of the innovative educational program, the department was equipped with an active navigation system for knee joint replacement, which is intended for navigational investigation of the knee and hip joints. The research activity involves treatment of deformations and degenerative diseases of the spinal column in adults and children.
Ортопедия сейчас идет очень быстрыми шагами вперед, и точность, а также качество операций возрастает.
Nowadays, orthopedics is advancing very rapidly, and precision as well as quality of operations are increasing year after year. In the frame of the innovative educational program, our university purchased a navigation system and some instruments. All these cost very much. This is the first step to the introduction of this potential into practice. A training base for students both from our country and particularly from abroad will be set up here. Former graduates of People's Friendship University of Russia, who now live in other countries, will willingly come to us in order to master this method. The Medical Center of People's Friendship University of Russia was founded in 2005. In the frame of the innovative educational program, the center was equipped with some new devices which enable to diagnose hepatocirrhosis at an early stage. The apparatus FibroScan was introduced into clinical work and is also used as an innovative component in the teaching process. The methods of fibroscanning are of great importance for hepatology and gastroenterology. It facilitates students in mastering new methods of diagnostics and treatment of chronic hepatic disorders. Numerous laboratories of the faculty are equipped with innovative devices, and students have an excellent opportunity to master new methods of treatment, and they do not miss their chance. The Student Scientific Society, which has been working successfully at the faculty for a long time, is a shining example of it. The main task is popularization of research work among students. The results of the activity have reached the world level.
Здесь ведется активная научная деятельность студентов.
Active research work is driven by students and lecturers at People's Friendship University of Russia. The example is an annual central event, final conference of Student Scientific Society. As a citizen of Hungary, I wanted to conclude a treaty on cooperation with the leading Hungarian medical education institution, Semmelweis University. At the moment, we are working under the bilateral treaty on cooperation according to the work program. More than 200 students participate in the research work every year. They give talks at conferences. They also win prizes at competitions arranged by the other Moscow institutes. Over and over again, they confirm the high level and status of the medical faculty. Medicine and art are inseparable notions. The doctor who has cured his patient is a professional and a fine workman. The doctor who can express his emotion authentically is a great artist. There is absolute harmony at the medical faculty. In the afternoon, the lecturers teach, the students study, but in the evening, they meet on the stage of their native theater in order to continue their service to Hippocrates. The students' theater is more than 10 years old. Its uniqueness consists in its company. There are professors of world reputation and future medics. This difference does not confuse anyone. The actors give themselves to the stage and audience.
Когда выхожу на сцену, я учусь выступать, я учусь свободно себя держать, я учусь, чтобы голос не дрожал.
When I come on the stage, I learn to perform, to behave freely, I learn to speak in a level voice, I want to express a composition as I understand it, as I feel it with my voice. All this demands work, of course. As the actors confess, performing on the stage is a chance to relax for them. And for the graduate of the medical faculty, dentist Mikhail Borisov, it's a chance to tell the audience about his feelings and to share his inmost thoughts. So even after graduation, he always finds time to meet his audience again. The most important criterion for me is how well we have played. If I can hardly walk after a performance, this is good. There is something that I have given to the audience, but if I feel well after a performance, that's not so good for me. I realize that I gave less than required, or underacted, or missed something. The idea of student theater came in 1999. The lecturers of the medical faculty set themselves as an object to enhance students' culture level. This idea was put into life by the theater director Shemkevich Tatiana Lvovna and the dean of the medical faculty, Professor Frolov Viktor Alexeyevich. For these years, more than 30 performances have been made on the basis of classical works by Russian and foreign writers. The most notable thing is that performances are almost never repeated. A new performance is only played once.
В театре у нас все равны, мы все артисты. Там нет декана, нет студентов, есть артисты.
All the participants are equal at our theater. We are all actors. There are no students, no dean there. There are only actors. Students get a great cultural education working at our theater. They begin to read what they would never read without it. When they come, they certainly want something funnier or more interesting, but they often suggest making performances on philosophic themes. Professor Frolov also meets his audience at the lectures on literature, music and history. The dean of the medical faculty tells students biographies of eminent people who dedicated their lives to literature, art and politics. According to Professor Frolov's words, speaking about famous persons and their activity, students do not only enrich their knowledge, but the major goal of young people culture education is achieved. The dean believes that a lecturer must also be an actor. This helps him to hold attention of his listeners and to arouse interest in the discussed subject.
У меня вот сейчас уже есть трехтомник. Я его называю трехтомником, поскольку
For today, I have already prepared a 3-volume edition of my works. I call it a 3-volume edition because the books were issued by the same publishing company and they have nearly the same design. The first book is named Mysterious Pages of History. This book is completely based on the materials of my lectures. In the next book, entitled Unknown About Well-Known, there are not only lectures, but some other editions. And not long ago, the third book was published. It is called The Past is Passing by Me. There are only few lectures and more editions in it. Not only professors, but also students organize and take part in lecture courses very actively.
Ребята организовали очень интересный, на мой взгляд, потому что это их идея, лекторий, но он был
In my opinion, young people organized a very interesting course of lectures because it was their own idea. But this was a video lecture course. Young people showed films about their country and explained why certain events were shown. This is very interesting. Young people asked a lot of questions, showed other culture and religion, and different cultures become more close and understandable as those students study together.
Great attention is paid to extracurricular activity at the faculty. Beauty contest Miss Medical Faculty is another shining and beautiful example which has no difference from Miss Universe, because in both cases representatives from various countries participate in this event. Ongoing through several steps of difficult examinations, the most beautiful, talented and intelligent young girl bears an absolutely deserved title Miss Medical Faculty.
В этом году корона победительницы медицинского факультета вручается Бешов Виктории.
Life at the medical faculty is like a mosaic cloth. Every detail of the picture is situated exactly in its place. This is a base of harmony between art of healing and art as it is traditionally understood. Fortunes and events are linked together. Say yes, it's impossible to imagine People's Friendship University of Russia without the medical faculty.